The U.S. travel ban on India now in effect. Oxygen and vaccines still in short supply in India as COVID cases there soar. More than 20 million total infections and over 3,400 deaths in just the last 24 hours. NBC News medical contributor Dr. Vin Gupta takes a closer look at the crisis there and what this travel ban means for Americans with loved ones in India.
Allison, Indian Americans across the country have woken up today with a lot of anxiety, recognizing that there isn't a lot that they can do to help loved ones miles away that are experiencing a tragedy unlike anything we've ever seen in this pandemic. U.S. families here are trying to send life-saving supplies like oxygen, PPE. Organizations are trying to do the same. We caught up with a gentleman, Kamal Garg, who actually was able to find 3 oxygen concentrators for one of his cousins who's severely ill with COVID-19 in India. This is what he said when I asked him why he wishes he could do more.
Should I send them faster and spend more money and then buy fewer concentrators, or should I buy more concentrators? And, everything here, there's no easy answer, like no decision. You're never going to come out of this feeling good. There's no finish line. There's no trophy. I feel like I'm just throwing drops in the ocean. But I have a tremendous amount of privilege that I can go and get cash and buy a concentrator and pay to ship it to India. And my family, who are well off and well educated professionals in India, have someone like me who can pay for this and ship it to them. I mean, I'm an American, I live in America, and the capacity for America to affect change in the world is enormous. And I frankly don't know why we don't have military cargo planes flying 24/7 in a loop to India, delivering concentrators and ventilators and PPE at a more rapid pace.
Allison, the thing to note there is it costs upwards of $3,000 for Kamal to actually purchase 3 of these oxygen concentrators. $3,000, plus probably hundreds of dollars on top just to get these concentrators to India in a timely fashion. Just not something that most families can afford to do. Let's recognize that the pandemic here in the United States is in a much different phase than it is in India. In India, they're experiencing a reality that's far worse than the worst of it here in the United States back in January. And that's why community organizers like Lalit Appala are stating that the government here, both here in the United States and elsewhere, governments with means need to do as much as they possibly can to mitigate the immediate loss of life. Here's what she said.
This is not something that a individual or a community-based organization can do alone. It's about all of us, humanity, coming together and addressing with compassion, with respect, and with hope. Because we got through it last year. We have vaccines. And that vaccine is a people's vaccine. It is not a country's vaccine. I think for our leadership, both here and across in India, it's about asking for compassion. It's about asking for collaboration and to come out as a united front. This is a global issue because, look, a virus in India that is so contagious, a mutant that is so contagious, is a virus everywhere.
Across the board, Allison, what we're hearing is that we need more. We need more governmental support. And that's what Indians are clamoring for here and elsewhere. We need more governmental support to mitigate the immediate loss of life.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.